Hello and welcome to today's presentation on understanding and managing adenomyosis. My name is Gareth Falls and I've launched this as a part of a series of webinars and presentations on women's complaints, gynecological issues. And I'm thrilled to have you here as we explore this condition that affects so many women. And we're going to cover what adenomyosis is, its symptoms, its risk factors, and how it can be managed both through conventional and herbal approaches. Now, adenomyosis is a benign condition of the uterus with an unknown cause that typically affects women in their 20s to 40s. Now, it's thought to arise from abnormal growth and the invasion of endometrial tissue into the myometrium, that's the muscular layer of the uterus. And this condition is fairly common, but it's often underdiagnosed. Now, the symptoms of adenomyosis can often be similar to those of fibroids. So there can be menorrhagia, this is the heavy menstrual bleeding, a feeling of congestion or heaviness due to increased uterine size. And quite often you'll hear people talk about a dull, dragging, aching pain in their pelvic area. Now, risk factors are similar to those of endometriosis. So if you are in an estrogen-dominant environment, that's in your xenoplastics, and even if you're producing too much estrogen yourself, you may have experienced multiple childbirths, a number of C-sections, or surgery for perhaps a previous fibroid removal. Orthodox medicine typically treats adenomyosis through a hysterectomy eventually, which will be a surgical removal of the uterus. Now, in less severe cases, you might be able to be treated with NSAIDs, that's non-steroidal anti-inflammatory drugs, which are suggested to manage pain. You might also be given an intrauterine contraceptive device, that's an IUCD, which will be used to try and reduce menstrual flow. It's not an ideal picture, and ultimately with a hysterectomy being so drastic, it is important that we look at other alternatives. So let's get into the therapeutic aims, the herbal strategies for managing adenomyosis. Now, our primary goal is to reduce inflammation, to manage pain, and to balance the estrogen levels within the body. We also want to support the liver function. Now, the reason for supporting the liver is because the liver is responsible for excreting excess hormones. And if you are estrogen dominant and you have too much circulating in your system, but you also suffer from constipation, that is going to be reabsorbed back into your bloodstream and lead to an elevated picture of estrogen in your system, which clearly is undesirable if that's one of the reasons why you might have adenomyosis in the first place. So reducing inflammation, the key herbs here are herbs like turmeric and boswellia, and that's frankincense, which is really strongly active as an anti-inflammatory. You might also want to consider something like flaxseed. So flaxseed's a phytoestrogen. It contains a number of omega-3 essential fatty acids, and they are by themselves anti-inflammatory. So it's really useful for all females, irrespective of age, to keep a balance of the hormone system that's at play during that cycle. We want to manage your pain, and there's two great herbs that are typically used for this. One of them is Dioscorea villosa, that's wild yam, and cramp bark, which does exactly what it says in the tin. It is an antispasmodic. Now, just a caveat here about wild yam. There's a lot of things online about wild yam being seen as progesterogenic. That is that it creates more progesterone in your body. It does contain some progestins, but they are not bioavailable. They're not absorbed in through the bloodstream, and they're not absorbed through your gastrointestinal tract. They do, however, contain phytoestrogens, and it's the phytoestrogens that give Dioscorea most of its properties. We want to balance estrogen dominance. So again, Dioscorea and flaxseed are two of the key herbs. And then in supporting your liver function, we're going to be thinking about herbs such as milk thistle, chelidonium, dandelion root, which are all helpful for improving the detoxification process of the liver. Further strategies are going to include things like improving your bowel movements. So soluble fiber, bitters, hepatic herbs are all very useful here. You want to reduce the menstrual bleeding, and particularly if you are prone to very heavy flooding or heavy bleeds. There's a number of herbs that are known as alternatives, circulatory stimulants, and styptics that stimulate the circulation in and around the pelvis, but also stem blood flow. So they're going to encourage you to bleed, but they're going to stop the bleed from becoming excessive. So this includes herbs such as lady's mantle, horsetail, yarrow, shepherd's purse, and trillium erectum. We also want to try and encourage your lymphatic flow, and that's going to include herbs such as calendula, thuya, and ruta graveolens. Now, all of those are going to be provided for you on a separate handout, and you can go through those individually and actually look into what those herbs do and why they are given. We also want to address your diet. A diet rich in soluble fiber is recommended. So we're going to include things like oats, legumes, fruits, vegetables, barley, seeds, and fermented milk products. We want to maybe consider a daily seed mix to combine things like flaxseed, almonds, pumpkin seeds, sesame, sunflower, along with some slippery elm and psyllium husk. Now that is because of the essential fatty acids. It's the insoluble fiber to try and keep you going regularly. And you might want to consider something like unsweetened yogurt with fruits such as apples or pears. Herbal teas are quite often prescribed to help as carminatives and to ease some of the cramping. So you can have chamomile, peppermint, or lemon balm whenever you're cramping, and up to 3 to 5 cups a day. Now moving on to foods to avoid. Stimulants such as tea and coffee are best avoided. Fried foods, pastries and ice cream are also best to be left aside. You want to stay clear of yeasty breads, refined sugars, and foods that contain refined sugars. Laxatives should also be avoided because they can actually disrupt the digestive function and prevent absorption of the many nutrients that you should have in your diet. So let's look at some of the herbal formulations that I would regularly use. I mean, first of all, if you are exposed to flooding or very heavy bleeding, I might prescribe to you a mix of yarrow, shepherd's purse, lady's mantle, cinnamon, wild yam, and cramp bark. That would be taken almost like a teaspoon every 15 to 20 minutes until the bleeding subsides. So clearly I'm wanting to see action happen within the first hour or so. I might prescribe some bitters. This is a blend of chelidonium, gentian, berberis, and licorice, which can be taken before meals to encourage peristalsis and to improve digestion. And then as a digestive mix, there's a number of herbs that would be helpful just to make sure that you're going regularly if the bitters didn't do it themselves. So things like rhamnus, acorus root, chamomile, milk thistle, chelidonium, dandelion root, berberis, and vitex can all be taken diluted in water. And then on to the supplements. So calcium D-glucarate is found in fruits and vegetables, and it supports phase 2 of the liver detoxification pathway. There's choline, which is present in meat, poultry, fish, dairy, eggs, and it supports brain health and liver function. DIM or I3C is derived from cruciferous vegetables, and these compounds are anti-inflammatory and anti-cancer. Now I should say that it is worthwhile spending the money to go and get organic and pasture-fed meat and organic vegetables themselves. A few other supplements worth mentioning are folates, which are a methyl donor, which is partly to support the liver function. L-methionine or SAM-E, which is found in meat, fish, dairy, nuts, and grains, and it's useful for fatigue, brain fog, memory enhancement, and cognitive impairment. Magnesium is key for the liver and the digestive tract, and it's found in leafy green veg, beans, legumes, nuts, milk, and yogurt. NAC is found in foods such as poultry, yogurt, eggs, and garlic, and that's helpful at protecting the lungs and supporting the liver. Selenium, often found in Brazil nuts, 1 or 2 a day, some B6 and B12, which are found in beans and meat, respectively, and eggs. So in conclusion, adenomyosis can be managed effectively with a combination of herbal therapies, dietary adjustments, and nutritional supplements. While conventional treatments like a hysterectomy might be necessary in severe cases, there's many holistic approaches that can help alleviate symptoms and improve your quality of life. Thank you for joining me today on this presentation, and I hope you have found that the information here is useful. And if you have any questions or need further guidance, then please don't hesitate to reach out either on the community here on the New Zealander platform, or you can contact me directly by email at thewildsageproton.me. Thank you so much. If you are interested in any of the other female complaints, or indeed the first aid course at the Cancer Hub, you can scroll through some of the educational platforms and see what else is on offer. Cheers.